Good morning, this is Miss Mindshine. I'm going to do a voiceover for your vital signs notes that you've been taking. I know that we got stuck kind of right in the middle of pulse before I was out for a couple of days. So we're just going to practice counting for 30 seconds. So what you see on the screen right now is a clock. And the clock has the short hand, which would be the hour hand, and the long hand, which would be the minute hand. So on the clock on your screen, you see that the hour hand is pointed to the 9, and the minute hand is pointed almost to the 1. So this time would be 9:04. The third hand that you see is the second hand. So that second hand actually goes all the way around the clock in 1 minute. So when you're doing pulse or respirations for counting, you need to determine when to start and when to stop counting. If it's regular for pulse, once again, you are going to count for 30 seconds and multiply by 2. If that is irregular, you would count for the full minute, because when you're measuring pulse, you're measuring how many times the heart beats per minute. So just to test, if you started with that second hand on the 12, you started counting pulse, when would you stop? Hopefully you said at the 6. So if you started with the second hand on the 3, when would you stop counting? And hopefully you would say at the 9. So you can see that those numbers are directly across from each other. And usually 12 and 6, 3 and 9, those are easy to determine, but you're not always able to wait until it gets to the 12. You may have to start at 1. So let's just practice. If you started at 1, where would you stop counting for 30 seconds? And hopefully everyone said at the 7. And if you started at the 2, where would you stop counting? And hopefully you said at the 8. So we'll have to practice that when we do these in class. If you will just continue to try and practice that on your own so that you can really be proficient at it, because that's one of the things that, especially during our skills testing, nurse aides have difficulty with. So counting a pulse, just to review, we usually count for 30 seconds and multiply the number by 2. And that gives you the rate per minute. You're not just looking at the number, you're looking at the rhythm, and that's the pattern. So it could be regular or irregular. If it's irregular, you count for a full minute. And what you'll learn is that an irregular pulse is called an arrhythmia, without rhythm, arrhythmia. We also observe force of the heartbeat. And words that you can use to describe force are strong, weak, bounding, thready, feeble. So if you see those words, you know that those are used to describe pulse. Radial pulse is the most common. You can just take that pulse without exposing the person's body. Once again, it's taken on the thumb side of your wrist. And you don't use your thumb to take a pulse, because your thumb actually has its own pulse, and you can sometimes feel that. You use gentle pressure, and once again, you're going to count for 30 seconds and multiply by 2. So if you can take a moment and feel your pulse, and just make sure that you can find it, and then find it on your neighbor, and make sure that you can find it on your neighbor as well. Okay, we're going to look at a stethoscope, and once again, we'll practice this in class. You need to know that the stethoscope has some common components. You have earpieces, and those are interchangeable. You can, when you get your own stethoscope, you can pick the earpieces that feel most comfortable for you, that fit in your ear well. You always want to clean the earpieces with alcohol before you put them in your ear and after you use them. Typically, you want to adjust those where they're tight enough for your size, and then also point them towards the front so they fit into your ear snugly. You'll notice that some stethoscopes have a single tubing and some have a double tubing, and once again, that's your preference. There are also different lengths of tubing and colors of tubing. The diaphragm is the part that you listen with. You put that on the person, and there's one side that has plastic, and that's a diaphragm. And then sometimes they're open, like the one in this picture, and that's called a bell, and that's used to listen to different heart sounds. You always want to warm the diaphragm in your hand before you put it on the person. When you want to listen for a pulse, such as the apical pulse, you're going to put it right over the artery. When you're listening for the blood pressure, you're going to put it over the brachial artery. And when you have this in your ears, you don't want to let the tubing bump against anything, because you'll hear that instead of the sound that you're listening for. You also don't want to have it in your ears until you're really using it, because when that diaphragm bangs on something, that's loud too. We're going to talk about the apical pulse. You can see in this picture that the apical pulse is measured using a stethoscope, because you can't really feel that pulse. So we're putting the stethoscope right at the apex of the heart, and it's on the left side of the person's chest. You take it with a stethoscope, like I said. You're going to place the stethoscope over the apex of the heart. You count an apical pulse for 1 full minute, because you're usually using the stethoscope to take an apical pulse if you have a problem such as really rapid, difficult to measure, irregular, things like that. So you're going to hear a lub dub, and that lub dub is counted as 1 heartbeat. So you don't count lub as 1 heartbeat and dub as another. That's just lub dub is 1 heartbeat. Irregular pulse rate, medications that can affect the heart. These are times when we would take an apical pulse rate. There is a technique called apical radial pulse, and you'll see from the picture that it takes 2 people to do this. So you're counting the apical pulse with the stethoscope, and you see the lady in the picture doing this, and then there's someone else taking the radial pulse. So typically the apical radial pulse should be the same. Sometimes when the heartbeat is not strong enough to create a pulse in the radial artery, you'll see a difference. So if the heartbeat's not strong enough, then the radial pulse is going to be less than the apical pulse. So once again, one person counts apical, the other person counts the radial, and what we're going to say is if there's a difference, we call that the pulse deficit. So if the radial pulse is less than the apical pulse, that's called a pulse deficit. Normal pulse rate for an adult is 60 to 100. We need to note that the prefix tachy means rapid or fast. So a heart rate over 100 is tachycardia. And then brady means slow, so a heart rate less than 60 is bradycardia. Anytime that you find an abnormal heart rate, if you're a nursing assistant or a tech, you're going to report that to your supervisor immediately. Now, if you are the nurse, you would want to recheck that and then possibly call it to the doctor. Okay? So we're going to move on to counting respirations, and you should have a new guided notes for this section of the PowerPoint. So first of all, respirations, you're looking at the lungs and respiratory tract. That's what goes into your blank right there. Lungs and respiratory tract. And you'll notice that one respiration consists of 1 inspiration and 1 expiration. So you don't count the inspiration as a respiration and the expiration as a respiration. It takes 1 of each to make 1 respiration. So breathing in is inspiration, it's when the chest rises, and then breathing out is expiration, that's when the chest falls. So you're going to be looking at the person's chest. Sometimes you may want to put your hand on the chest, or put a little piece of the alcohol pad, or put the alcohol pad on the chest, something where you can see it moving. You need to position yourself where you can see your clock, and the chest at the same time. So you're going to count each time the chest rises. So once again, if the respirations are regular, you're going to count for 30 seconds and multiply times 2. One important factor is that you do not let the person know you're counting their respirations, because respirations is a vital sign that we can control. So if we know that you're counting it, then we may try to control how fast we're breathing. So what you do is you're going to take the pulse, and after you count the pulse and remember that number, you're going to keep your fingers on the pulse site while you're counting the respirations. And that makes the person think that you're still counting their pulse, and it just helps them to not be cognizant that you're counting the respirations. So normal respiratory rate for adults is 12 to 20, and remember that this is measured as breaths per minute. I think that was one of your previous blanks. Your book also lists normal respirations for infants and children, and so you have some blanks on your notes for those. You can get that from your book. And just like pulse, we're not just counting the number for respirations. We need to note things like the quality or the characteristics, such as are they having difficulty with breathing? Are they spending a lot of energy breathing? Is it very labored? Is there congestion? Can you hear moisture when they're breathing? Are they making strange noises like snoring? So the next section of your notes has several different descriptors that you could use for respirations that were abnormal. So once again, the ones on the screen, tachy means fast, so respiratory rate above a normal range would be tachypnea, and brady means slow, so respiratory rate below a normal range would be bradypnea. DYS, that prefix means difficulty or pain, so dyspnea is shortness of breath, difficulty in breathing. And then if you see the A in front of it, that means without, so apnea is no breathing. Hypo and hyper, hyperventilation means too fast of respirations. Hypo means slow and shallow. And then you have several other words that you need to go and look up the definition in your book. One is Cheyne-Stokes, and that's a respiratory rhythm that's often seen in the dying patient. So you have a lot of different things that you can look up in your book and write those definitions. And I hope that you have a good rest of the day.